history taking. So there are 10 steps in history taking. There are 10 steps. The number 1 is introducing yourself and confirming the patient's name. Number 2, getting the chief complaints from the patient. Number 3, history of present illness using the OPQRST method, which I'm going to talk about later. Number 4 is the past medical history. Number 5 is family history. Number 6 is asking the patient for social history. Number 7 is reviewing the systems. Number 8 is summarizing the history. Number 9 is ICE, which I'm going to talk about later. And number 10 is the final question, and thank you, goodbye. So these are the 10 steps in history taking. So number 1, the first step, introducing yourself and confirming the patient's name. Now this is the step where you basically introduce yourself and your name. This is the first step in any kind of conversation. That way you can gain trust from the patient and patients can speak more comfortably with the doctor. Number 2, this is getting the chief complaints. This step is where basically the doctor asks the patient about the reason they came to see the doctor. Now, history of present illness using the OPQRST method. Now, this OPQRST method, or these letters actually stand for something. O stands for onset. Onset is about when and how often the symptoms appear. Place, P stands for place, and it's about the location of the pain or the symptoms. Q is the quality, and it's basically how the physical pain is felt. R stands for radiation, and it asks whether the pain moves from location to location. S is for severity, and it's about how severe the pain is. Usually you use a scale from 1 to 10 and you ask the patient how severe the pain is. Now T stands for timing, and timing is basically the timing of the symptom. So basically it's how long the symptom lasts. Now these OPQRST criteria are crucial for identifying the specific cause and causes of the symptoms. The next step, you ask the patient for the past medical history. So this is because the current symptoms that the patient is showing may be related to a disease or illness from the past. Therefore, by viewing the past medical history, it may help find the cause of the illness. Now the step after asking for the past history is family history. So you ask the patient for the patient's family history. Some genetic diseases are passed down from parents to parents. So therefore, family history may give a hint of the disease during diagnosis. The next step is social history. And this is where you gather information about the patient's social history and background. Sometimes the patient can be in a very stressful environment, and that can be a cause of a certain, let's say, mental diseases. So gathering information about their social background is really important. The next step is the review of symptoms. So this is where you gather information related to other symptoms that were not covered in OPQRST criteria. And then the next step is summarizing history. So this is where doctors review the history of the patient to prevent misunderstanding and for more precise understanding of the patient. And ICE, this is a step where doctors inform the patient about their thoughts and understanding of the symptoms. And finally, this is a step where doctor asks the patient for any last question and polite thank you and goodbye. Okay, these are the 10 steps that are important when you're history taking. Okay, so Mr. Oshi, please come in. Hi, so I'm Yuta, so please sit down. Can I confirm that your full name is Oshi?
Yes.
Okay, so how can I help you today?
I've been having fatigue and blurred vision recently.
I see. So you have been having a fatigue and blurred vision. So could you tell me more about it?
Well, I've been having muscle fatigue and dull at the same time.
Oh, okay. So you have some dullness. You know, I would like to ask you a few questions about your symptoms. Could you tell me when it started and where specifically the symptoms appear?
Well, it started like 3 months ago, but it got worse from like a month ago. And I've been having muscle fatigue and dullness all over the body.
All over the body. So does the location of the pain move over time?
No, it felt almost the same time, at the time, and it's all around the body.
I see. So you're experiencing it all day.
Yes.
Oh, I see. Could you tell me what the pain feels like? Like if you were to scale it from 1 to 10, how severe is the pain?
I'd say like 4 to 6, but it's always there.
I see. Well, okay, is there anything that makes your condition worse?
Well, I can barely do any exercise nowadays, and walking and exercise makes my condition worse.
Oh, I see. Is there anything that makes your condition better?
Well, I feel better when I drink water.
I see. So, does lying down help relieve some of the pain?
Sort of.
Oh, I see. So, have you noticed anything else about your symptoms?
Well, I've been going to the toilet more frequently recently because I drink a lot of water.
Oh, I see. So, that means that you urinate very often.
Yes.
I see. Okay, thank you. So now I'm going to ask you about your health in general.
Okay.
So have you had anything like this before?
Not really.
Okay. Have you ever had a major illness or injury in the past?
No.
Okay. Have you ever had a major surgery or an operation in the past?
No, I've never experienced surgery before.
Okay. Are you taking any medication or over-the-counter drug at the moment?
No.
Okay. Are you allergic to something?
No.
Okay, thank you. Okay, so next I'd like to ask you about your family's health.
Okay.
Are your parents alive and well?
Yes, they are alive and well.
I see. Are all your close relatives fit and well?
Yes, I think all of them are fit and
I
well.
see. Does anyone in your family have serious illness?
No, not really.
Okay. Okay, thank you. Well, now I'm going to ask you some personal questions.
Okay.
Well, everything we talk about here is confidential. Do you have a partner?
Yes.
Okay, who do you live with?
Wife and son.
Okay, are there any like stressful moments at home?
No, not really.
Do you work right now?
Yes, I work as a businessman.
Okay. Do you have anything troubling or stressing at work?
Well, yes. My company makes me work until 11 p.m. every day, and I think it is a little stressful. Even I've gotten used to it.
I see. So, let's say, does drinking beer and eating help you release some of the stress?
Yes, definitely. Eating is the only time in a day where I can feel happiness.
Oh, I see. How often do you drink in a week?
Every day after work.
Oh, okay. What kind of drink do you drink? Like beer, wine?
Yeah, beer mainly.
I see. So do you have any hobbies or interests that you do in your free time?
Watching movies at home and relax.
I see. So you like to relax mainly. So, okay. I'm going to ask you a few more questions. So just making sure I don't miss anything important. So what's your appetite like recently?
Well, I have been eating a lot recently, especially after work.
Okay. Have you had any loss or gain in weight?
Well, I've been eating a lot, but I've been losing weight recently.
Oh, how many kilos did you lose recently?
About 5 kilos.
I see, 5 kilos. Okay. Do you feel any of these symptoms? Like, do you feel dizziness?
No.
Nosebleeds?
No.
Coughing?
No.
Wheezing?
No.
Chest pain?
No.
Swelling of the ankles?
No.
Nausea?
Sometimes.
I see, okay. Heartburn?
No.
Abdominal pain?
No.
Diarrhea?
Yes.
Okay. Do you have any problems urinating?
Yes, I'm urinating a lot recently.
I see. Do you have any pain in your muscles or joints?
No.
Okay. Do you have any rashes?
No.
Problems sleeping?
No.
Okay. Ringing in the eats?
No.
Sore throat?
No.
Coughing up blood?
No.
Okay. Do you have any loss of bladder control?
Yes, as I said, I'm urinating a lot.
I see. Okay, thank you. Thank you very much for answering a series of long questions. Let me summarize your condition. So to summarize, you have been feeling muscle fatigue all over the body, and that you have been experiencing blurred vision, and that you have lost 5 kilos. Is it correct?
Yes.
Okay. Do you have anything else that you are worried about, or anything that you want to add on to?
No. Okay.
Okay. Do you have any last questions for me?
No. Thank you very much.
Okay, well, thank you very much for spending a long time with me. The doctor in charge of you will come to see you later. So next, you will take some blood samples. So the doctor in charge will call you. So please wait in the waiting room.
Okay.
Thank you very much for coming today.
Thank you very much.
Okay. Okay, so we will be measuring your blood pressure, and we will be taking your blood samples.
Okay.
Okay, so that's it for today. So your result will be out in a few days. So please visit the hospital again next week.
Okay. Thank you, doctor.
Okay, thank you very much. That's it for today. Thank you. I'm gonna explain about breaking bad news. So usually when you're breaking bad news to the patient, you use this universal protocol called spikes. Now, the spike steps the protocol is used all over the world, and it stands for setting, perception, invitation, knowledge, emotion, and summary. I'm going to clarify each of the steps in this video. So the first S stands for setting up the interview and session. So this is basically a step where you basically set up the environment to maximize privacy for the patient and to avoid interruption from outside. This helps the patient listen and understand. It also helps respect confidentiality and provide support for the patient. Step 2 is where you actually meet the patient and you find out how much the patient knows about their illness before you break out the bad news. Now, the third step is obtaining the patient's invitation. Now, this step is basically finding out how much the patient wants to know about their illness. This is also the step where you ask the patient whether they want to hear the news with someone else or with some family member and so on. Depending on the patient's personality and the strength, mental strength, I guess some people prefer listening it with family members, while some people want to hear it alone. Okay. The next step is giving knowledge and information to the patient. This is the part where you give knowledge of the illness, and this is also where you basically inform the patient about their illness. This is where you break the bad news. Then there's obviously, after breaking the bad news, there's going to be some emotion in the patient's side. So the next step is addressing the patient's emotion. This is the step where you respond to the patient's emotion and feelings. Finally, this is the step strategy and summary. So this is the step where you ask the patient if they understood everything. The strategy. This is also a step where you can talk about the strategy going forward. What kind of things awaiting to the patient. This is where you explain to the patient what's going to happen next. Okay, so these are the 6 steps, the spikes protocol, that's often used all around the world for breaking out bad news. Okay, please come in. Okay, so good afternoon, you. Thank you for coming back today to the hospital. So I have turned off my phone and told the hospital staff not to disturb us, so that I have undivided attention to
Thank you.
Okay, so how have you been feeling today, lately?
I feel like the condition is getting worse.
I see. I understand your hardship. What do you suspect is going on?
I'm not sure, but since I'm losing weight, I don't think that I have disease related to diabetes, but I'm not sure.
Okay, thank you. Well, the results of your blood tests are out, so before I tell you the result, would you want me to tell you the result now, or do you want to hear the result with a family member?
Well, I want to hear it now.
Okay. Well, the result of the blood test shows that, unfortunately, you do have a type 2 diabetes.
But I'm losing weight right now. I thought type 2 diabetes for people who are overweight.
Well, let me give you a very short explanation. When you have a type 2 diabetes, your cells become more resistant to the action of insulin, and which is a hormone that helps bring your blood levels down. So this means that the energy or the sugar that you intake stays in the blood, barely absorbed by the body, which basically results in a weight loss.
Diabetes? Does diabetes get worse? Is that serious?
Well, the disease is it really depends on person to person. There are cases where conditions improve with proper diet and exercise. Unfortunately, the condition of diabetes, the seriousness really depends on the person. But one thing for sure is that if you leave it alone, untreated, there's a high risk of your legs or fingers turning into gangrene.
Wait, what is that?
Well, gangrene is basically like the decomposition of your tissues. So patients with critical conditions undergo surgery where some sections of their bodies are removed. So, however, this is the worst case scenario. So luckily you have not reached a critical state yet. So with proper dietary control and diet and medication, you can go and improve your condition.
How long does it take me to recover? And what kind of medicine are you receiving?
I understand your anxiety. To answer the first question, it really depends on the person. But since you are relatively young, there is a possibility that you will recover faster than other patients. For the second question, what kind of medicine I'm prescribing, you will be prescribed insulin. From now on and forward, we will need you to come to the hospital regularly to take a blood test so that we can monitor your condition and adjust the amount of medication.
Okay.
Do you have any questions?
No.
Okay, well, before we wrap up today, I want you to make sure you understood everything. With your own words, can you please summarize to me what we talked about today?
Well, I have type 2 diabetes, and to fix it, I will have to go through food restriction and do some exercise.
Yes. Yes, that's right. So do you have any other questions?
No.
Well, thank you very much for spending a long time with me. The nurse who's in charge of you will come to see you later. So please wait in the lobby.
Thank you.
Thank
Bye.
you. Goodbye. Okay, next I'm going to be talking about universal upset patient protocol, which where doctors use for when facing angry patients. There are 7 steps to this universal upset patient protocol. Step number 1 is facing the patient. What it means by facing the patient is you have to face the patient face to face, and you have to give the patient eye contact. Step 2 and number 3. This is the step where you tell the patient that they look upset. And step number 3, you tell me more about it. So these 2 steps helps the patient realize that they are upset. If they share their feelings with you, a doctor should listen quietly. If they seem like they don't want to share their feelings, you don't have to force them to share their feelings. Now step number 4 is you have to show empathy. This is a step where you show empathy to the patient. So you say, I'm sorry that this is happening to you. Now, in this step, eye contact is definitely necessary. Well, actually, I need to show eye contact throughout, but in this step in particular, you do have to show eye contact to show empathy. Now, step number 5 is the step where you ask the patient, what would you like me to do to help you? This is a step that allows the patient to, by asking the patient what they want, it allows the patient to become an active participant. Also, by asking the patient what they want, it helps rationalize their thoughts. Number 6 is the step where you ask the patient, here's what we can do. So this is a step where you give them an option or solution to a possible solution to the situation. Now, the final step, step number 7, is where you thank the patient for sharing their feeling with the doctor. Obviously, sharing your feelings with someone else requires a lot of courage. So by thanking the patient for sharing their feelings, it really makes the patient satisfied that with the fact that they shared their feeling with someone else. So these are the 7 steps that's often used to face angry patients. Okay, come in. Hi. Thank you for coming back in today.
Doctor, I've been waiting outside for 2 hours. There are kids around screaming and running like animals.
I'm sorry for having you wait for so long. I hope you understand that we are doing the best we can to make time for every patient. From now on, let me concentrate on your session. Is that
Yes,
okay?
but can you at least tell the kids to calm down?
Oh, okay. It's true that they're causing troubles to some patients. I'll make sure to remind the hospital staff.
Okay.
Okay, so you're going to have another blood test coming in.
Again? I just took it last week and I've been freaking out since you told me that I have diabetes. But I just don't think that I can deal with it anymore.
I understand you're having a hard time. Can you tell me more about it?
Well, drinking beer after work is the only form of happiness I feel in my life. But the alcohol restriction that you place on me is taking the happiness away from me.
I understand your hardship and the struggles that you're enduring.
As you know, I've also stopped eating pizzas and hamburgers, but I can't endure these dietary restrictions. There are lots more I want to eat, and I keep thinking to myself why I'm the only one who can't enjoy life.
Well, I think you're doing great with your diets, and if you keep up with your effort, I'm pretty sure you will get better.
Thank you, doctor, but I'm not sure how long I can hold on.
Well, is there something you would like me to do to help you?
I hope there is. I'm just too stressed about my daily life.
I see. I understand. Well, actually, there are some communities where patients with diabetes come together and share about their hardship and achievements. I can introduce you the community if you're interested. That way you can go and share your anxiety, and people going through the same hardship can you can basically share your anxiety with the people going through the same hardship as you.
That sounds interesting.
Well, I'm sure it will help motivate you.
Yes, that might be helpful.
So if there are no more questions you want me to ask me, let me explain about the next examination.
Okay.
So after this session, you're going to have another blood test. This is for checking whether you're going well with your medication and diet. Okay, so hi. How have you been, Mr. Oishi?
Hi, doctor. I'm feeling better.
Oh, that's great to hear. I remember introducing the diabetes community. Did you try out?
Yes, I went to the community last Sunday.
Oh, how was it?
Actually, it really helped.
I see. Well, the result of the blood test is out, and your condition is indeed getting better, so we can slowly decrease the amount of medication.
Oh, that's good to hear. Well, we are going to continue the food restriction, right?
Well, yeah, we will need you to continue the dietary restrictions a little more. But if your conditions continue to get better, you'll be able to start drinking again.
Oh, that's good to hear.
How's exercise?
Well, I started jogging, and I think it is helping me stay fit. It also helps me to refresh my mind, so I want to continue exercising every day, even after my condition recovers.
I see. That sounds great. I'm glad to hear that. I'm sure you do have stressful times, but you're doing great, and let's continue this journey together a little more.
Yes.
Well, thank you very much for coming today. Do you have any questions?
No.
Okay, well, good luck and see you next time.
Thank you very much, doctor.
Okay.